we understand the stings of stigma and discrimination, especially HIV-related stigma and discrimination. And we recognize those amongst us who are able to come out, speak out and influence others to also not to hide and suffer in stigma and discrimination. May I also, in a special way, recognize the survivors of gender-based violence. Wale ambao wanazidi kudulumika lakini wamejitoa in our communities na wamesema they'll not keep quiet. They'll stand up and speak out the ills in our society so that they can influence and touch the lives of others who are going through similar experiences. Bwana County Commissioner, in a special way, I also want to recognize the community health volunteers. But for bila community health volunteers, we do not have primary health care. Hawa wanafanya kazi mzuri sana in our community. And we really appreciate and recognize our government kwa sababu the government is putting in place infrastructure to ensure kwamba the community health workers are well remunerated ndio waweze kufanya kazi vizuri at the primary health care level. So I want to thank the people of Siaya County for hosting us today in your county as we continue to address the 3 threats: new HIV infections, adolescent pregnancies, and sexual and gender-based violence cases. These issues are interrelated and they have significant consequences for our society, and particularly for the health and well-being of the young people, not only in Siaya, but in Kenya as a country. Kenya has a youthful population. Thank you. Kenya has a youthful population. About 59% of the population aged below 24 years. In Siaya County, where we are right now, this is even higher, with 61% of the total population being young people below age 24 years. Adolescents aged 10 and 19 years were 268,530, which contributes to 27% of the total population in Siaya County. These are very, very huge number of young people in Siaya County whom we are targeting with these interventions around the triple threat. This youthful population is particularly vulnerable to the triple threat. And we've talked about new HIV infection, adolescent pregnancy, and sexual and gender-based violence. HIV is a significant public health concern in Kenya. Nationally, there has been a decline in new HIV infections among adolescents aged 10 to 19 years by 72% from 18,000 in 2015 to 5,123 in 2021, and translating to 99 new HIV infections every single week. However, Siaya County still contributes 7% of these numbers, and this is around 371 new HIV cases annually of new adolescents and HIV infections. Routine HIV testing is crucial in identifying and treating HIV, and in Siaya County, 79% of the total adolescents HIV positive tests in 2022 were among females aged 10 and 19 years. This indicates that more needs to be done to ensure that young people are aware of the importance of HIV testing and treatment. Because we do understand that HIV testing is the entry point into care. And so that is why we continue to advocate that 100% of our population wamejua hali yao ya HIV. Wale wako positive wanaingia care na wanaishi maisha yao kama kawaida. Wale ambao wako negative pia wanahimizwa waendelee practice safer sex. Furthermore, there is still a lack of knowledge about HIV prevention among young people. Slightly more than half of the young people aged 15 to 24 years in Kenya know about HIV prevention. Nationally, however, in Siaya County, 71.5% of young people aged 15 to 24 years have knowledge about HIV prevention compared to 39.9% among men. So we are having more young people ambao ni females wanajua mambo ya HIV prevention kuliko our young men. This shows that more needs to be done to educate young men about HIV prevention and ensure that they have access to information on safe sex practices. Adolescent pregnancy is another significant issue affecting young people in Kenya. And in Siaya County, where we are now, there were 10,558 adolescent pregnancies among girls aged 15 to 19 years in 2016. Tunasikia hizo statistics, which declined to 7,000 in 2021. Hata kama kulikuwa na decline, still a lot needs to be done, okay? These numbers are still high and indicates a consistent high trend of teenage pregnancies, which can have long-term consequences for young girls, including increased risk of maternal and child mortality and morbidity, dropping out of school, and societal and social stigma. Finally, sexual and gender-based violence is pervasive in Kenya, affecting both males and females of all ages. However, young women and girls are particularly vulnerable to this type of violence, which can have significant physical, emotional, psychological consequences in this age cohort. The government and civil society organizations must work together to create safe spaces for young people and ensure that survivors of sexual and gender-based violence have access to the support and care that they need. The triple threat of new HIV infection, adolescent pregnancy, and sexual and gender-based violence among our adolescents and girls is a significant issue in Kenya. And so therefore, we need to work with the leadership, communities, and stakeholders at the national, county level of government to address these issues. I emphasize our dedication as a council to helping this county overcome the triple threat. Following this meeting, we will maintain ongoing communication to ensure that the goals and promises established here are achieved.
Gender-based violence is actually a silent epidemic due to the stigma those who are affected who are faced, because most people are unwilling to talk about it. And therefore, one of the challenges that I want to throw to all of us here, who are leaders in one or the other, is that we must start talking about it. We must start talking about triple threats in our forums, whether it is in the churches, public barazas, or forums. Teenage pregnancies here in Siaya County, they are also on the rise. And it's a high time we talked about it so that we can prevent them occurring. So, we have a serious responsibility to fight this pandemic. And therefore, I am requesting all of us to use all the opportunities that you have. As parents, we have a responsibility to fight the triple threat at homes. As leaders, workers of elders, we also have our forums. The religious leaders, I've seen you here, you have your roles to play, and all of us. Starting today, going forward, because we have all been sensitized, and I want to thank the government for training the people who sensitize the communities, for preparing the people, the training of trainers who sensitize the communities. Do your work. Don't acquire knowledge and then sit on it. use that knowledge to sensitize the members of public on how to manage or how to mitigate on the type of threat.
Siaya County has recorded very significant decline in new HIV infections among adolescents aged 10 to 19 years. And that is, the drop is from 2,355 in 2015 to a paltry 371 in 2021. Isn't that a very big drop? So can we give ourselves a big clap as residents of Siaya County? That reduction represents 84% compared to the national reduction rate, which was only 72. Imagine, Siaya County worked so hard from 2015 to drop their figures from over 2,000 to 371. However, with all that effort, the county still contributes 7% to the national estimate of adolescent new HIV infections, translating to 7 new HIV infections every week. If you listened closely, you heard that figure coming from none other than our director, Lucy. She mentioned that we get about 7 cases every week, 7 new cases in our county. That is not good. We need to reduce that to 0 new cases. And that's why we are here. There has also been a decline of 53% in AIDS-related deaths among adolescents in Siaya County from 2015 to 2021. There are also so many other achievements regarding the knowledge about HIV infection in our county. And there are also, furthermore, the percentage of women using condom in our county has really increased. And additionally, adolescent pregnancies in Siaya County, although they have remained high with 10,557 pregnancies among those aged 15, the proportion of about 39 are attending ANC.
Hey! Polo hakuna kitu ana provide kwa hii nyumba. Nimechoka na yeye.
Ana kwa ana, be ready, and then we had a team that wanted to present.
Ikuja, anda kutukoda, anda kanyono. Agalo nani kusema kiduduogo? Uduogo timano. Meruoto. Mamuoto.
Adawe.
Itingo nyatima person for strategy. Joel Milambo, you will also come and give a talk. By observing what is called the paper.
That we get in
So that is why we have,
because it
so
involves
at
accomplishing
the
others.
national government, he actually coordinated the HIV program at a provincial level for a long time, so he's very passionate.
Apelele usiepa yawa. Ena oma timi. Asto nerua ton kapona biro koru. Tobro riemba amobro timo na kako timo ni. Dongine no kikuodo wi. Kuodo wi ana.
Kwa mama, pile sasa asekweri. Mama utaka koni, ibedi taka kocha. Mama utaka kocha, ibedi taka koni. Kwa mama kakita.
Kama ingekuwa ile wakati niko na
let us lead, others follow. Sindio?